So let's get started. So these are the topics that we're going to cover for cause audits. Let's talk about that for just a second. I do well over 24 audits per year, GXP, pharmacovigilance, REMS, ISO, you name it. And audits by and large are pretty straightforward because you audit against a regulation or standard. But for-cause audits are a completely different animal. And the reason is, there's a couple of reasons, but the biggest one is no two are ever the same. There isn't really a standard to guide you when you're conducting a for-cause audit, other than the domain in which you're auditing, whether it's clinical, it's GCP, GMP, whatever the case may be. So the regulations are always out there and they do apply. But the reason we do a for-cause audit is not so much about regulatory compliance, although it is associated for sure. I personally like the challenge of conducting for-cause audits because I enjoy conducting investigations. And it does take a specific skill set, such as pattern recognition, critical thinking, what have you. And this presentation is designed to help you understand both sides of the for-cause audit desk, both preparing for and defending an audit and conducting a for-cause audit. So we're going to cover all of that. So topics include why they matter, common triggers, preparation, scope containment, auditor methodologies, leadership accountability, and response. Oh, by the way, even though this presentation is scheduled for an hour, that's mostly for Q&A. I doubt it's going to take that much time. Depends on how many questions we get. FYI, questions will come in via LinkedIn comments. And there may be a delay from when you submit the question to I get it. So if I look at my phone, it's because I got a question coming in on LinkedIn. Okay. What is a for-cause audit? Well, really, it's a targeted investigation triggered by, it could be a single event or it could be a trend of events, different events as well. Typically performed by a subject matter expert or experts. I've had that situation many times. The idea is to identify systemic issues that cause the events, and it's typically contrasted with a contract or a procedure, and I'll drill down on all of these in a moment. A for-cause audit is often related to performance or compliance, certainly quality, and most definitely safety. And a for-cause audit could be regulatory in nature, or it could be just business in nature, and I've had both of those, and often they are related. Now, why do for-cause audits matter? Well, while for-cause audits are in the minority of audits that I conduct and that people experience, they are the most impactful to the auditee. Why? Well, because they're almost always a legal matter. For-cause audits are serious as it gets. They're most likely to result in a major monetary impact. I have a quick little case study to talk about here at the end of this slide. But everyone I've been involved in did have a significant monetary impact to the auditee. For example, it could be loss of a client contract, a study, whatever the services are being provided. A delayed or rejected submission, I've experienced that as well, and that gets very expensive. Of course, always torts, liability, and lawsuits. Product recalls and market authorization revocation, I've been involved in that. And potentially a devastating impact. And there is a very recent case study involving Fresenius pursuing the acquisition of Acorn, not Acorn, but Acorn, a contract lab and manufacturer. This happened, it was a deal worth about almost $5 billion, and the transaction was announced in 2017. And what happened was there was a pattern of very significant data integrity violations by Acorn. Now, these aren't even necessarily IT systems data integrity. And when you hear data integrity, logically you think, oh, it must be IT systems related, but no, this was not. This was actually paper related. But it was a pattern that went on in the business, and a whistleblower brought it to the attention of regulators, and so Acorn, of course, did a for-cause audit, and they ended up canceling the deal. The findings constituted a material adverse effect, or MAE. Acorn sued to force contract closure, but the courts ruled in favor of Fresenius, and it didn't take long where Acorn had filed for a Chapter 11 bankruptcy, and they ended up effectively ceasing all operations and laying off all employees. So, like I said, a for-cause audit is as serious as it gets. They're no joke. So, what are some common triggers for a for-cause audit? It could be a single event, or it could be a signal, a pattern, and that's something that I did a lot of in my pharmacovigilance days, was signal detection, that is looking for patterns in data. But it's also kind of looking for patterns of deviations. A single complaint, rarely customer complaint, rarely triggers a for-cause audit unless it's egregious, and that's happened. Data integrity, on the other hand, is about 61% of warning letters, and they reference data integrity issues. They could include deficiencies in the data, missing records, backdating, which I've seen, falsification, poor audit trail control, etc. And they frequently escalate into a formal investigation or enforcement action that's more prevalent than you think. So when you think in terms of data integrity, it's not just about computer systems validation. Happy to do a deep dive on that another day. Whistleblower, we just talked about that with regard to the Acorn case study. Late submissions is another one, and an adverse event. Believe it or not, a serious adverse event, it may be only one, believe it or not. It's rare, but it happens. I once was working with a company many years ago called Affimax. They had just received their NDA and their PDUFA, and they began marketing their product, Peganistide. But the brand name is called Amontis, and it was used to treat anemia in chronic kidney disease patients that were on dialysis. Well, it turns out there were adverse events that resulted in serious hypertensive reactions, including anaphylaxis, and 3 of them were fatal. The FDA got involved, and the product was recalled, and the company's stock price dropped 85% in one day, and that was the only product the company had in the pipeline, and so the company quickly shut down. They were a client of mine for years, and things looked good up until that happened. So it doesn't take much to trigger a for-cause audit or investigation. Here are some others. I mentioned data integrity. Missing records are a big one. All kinds of electronic systems failures, protocol deviations are a major one, and poor documentation, et cetera. Downstream vendors can cause a for-cause audit. As you know, you can't outsource your regulatory compliance, so if it's coming through you, you own it. And I've seen all of these at one time or another. They're more pervasive than you think. Talk about scope expansion. I can tell you this from experience. It's 100% accurate. For-cause audit is nothing more than an open-ended root cause analysis. And it's not isolated to the simple 5 whys exercise. When I do a for-cause audit, I look at every layer of the peeled onion to reveal failure. And then I connect the dots. I'll do a deeper dive on that in a second. My standard audit strategy is a top-down approach. If I see a weak or missing policy or procedures, I can guarantee you the underlying procedures and work instructions are going to be equally weak or weaker. That's just a fact. If you have a good procedure, you better be able to prove it's being followed or enforced by deviations in CAPAs. Remember, perfection is not expected, but commitment to continuous improvement is. So what do we expect to see? Again, we're not looking for perfection, right? We're looking for control. So for example, if it's an IT system, does it follow a strict system development lifecycle? Traceability, whether it's technical or procedural, it really all comes down to this. Traceability is my #1 weapon in a for-cause audit. I trace issues back to their source. If you don't have 100% traceability, you're in trouble. That's just the facts. Excuse me. Accountability. Whether you're a sponsor, a CRO, an investigator, you own it. Pointing to a downstream vendor is not a defense. I've lived this one, and you're probably already aware of that. Data integrity of submissions that include structured study data subject to technical standards. Roughly 16% of study data are rejected due to data format and quality problems. And if that happens to a sponsor, and you're a service provider, they're going to want answers. And so you better be ready. Validated systems. I'm not going to beat up on this too much, but I do see that I do a lot of vendor qualification audits and vendor surveillance audits. Too many vendors, typically new or small vendors, companies, they try to rationalize on why their systems are not validated or loosely validated. But I refer everyone to the FDA's Guidance to Industry, published in December 2018, specifically item 3 on page 6, that says every workflow must be validated. I'm not going to quote it chapter and verse. Feel free to look it up for yourself. CAPAs. Let's talk about CAPAs for a moment. I see too many companies try to avoid a CAPA. Believe me, I understand CAPAs consume time and resources and can delay projects. But a missing or delayed CAPA is an indication to me of a dismissive or risk-tolerant culture. I see this far too many times. I call it trying to dance between the raindrops. You can do that for so long, but sooner or later, it's going to get caught. And when it does, it's much harder to explain. So I recommend that you just do the right thing from the start. It will protect you in the future. And that's what we're really trying to do, right? We're not trying to make sure that you're checking every box and you're operating perfect compliance with the regulations. What you're really doing is you're protecting yourself from future investigations or audits. So when I am auditing, I'm looking at your systems, I'm looking at your processes, and I'm also looking at your culture. Remember, I take a top-down approach. Most investigators will. Okay. Common findings in for-cause audits that I have conducted over the years. Non-validated electronic systems. I see this all too often. Trying to use spreadsheets and Word documents for GXP records is a top 3 observation of mine. It also includes poorly validated systems, which demonstrates, again, lack of control. So this is where patterns emerge. Failure to follow procedures and protocols. I see this a lot. If you see multiple instances of a failure to follow a procedure, you better look into it because it's really creating a signal out there that somebody's going to see. And I would also offer that simply requiring more training is not the answer. You really need to dig into this and find out what's going on there, because an auditor investigator will. Let's see. Inadequate or missing signatures. And by the way, I'm not just talking about electronic signatures. I'm also talking about paper or wedding signatures, especially if you're dealing with things like informed consent forms during clinical studies, even internal procedures. I see many issues with signatures. Poor vendor oversight is another one. I was involved in a for-cause audit where the CRO was not keeping track of the clinical systems vendor, and it caused a submission error, a data integrity error, and that triggered a for-cause audit. Also, CAPAs that are like a checkbox. Yeah, we put a CAPA together, and David and I have seen far too many CAPAs, especially in the medical record warning letters related to CAPAs, insufficient CAPAs. So they got to really address the issue, not just check the box. Let's talk about preparation. We really want to get ahead of it. How do you know, or how would you know that a for-cause audit is possible or could be in your future? Well, you want to be alert to inquiries from your client or the agency on any given topic. If you're getting frequent inquiries, they're onto something. And I recommend you start your own investigation. You definitely want to get ahead of it. Collect all records, including communications, no matter how innocuous. Having all those records at your fingertips is going to be key in mounting your defense. Make sure they're all stored in a single location and arranged in a chronological order, which is the next bullet. There we go. Yeah, so it's not enough to just have a pile of paper or a folder full of files. Start to arrange them in chronological order, and I'll demonstrate that in just a second. IT systems testing, especially updates and bug fixes. I mentioned that for-cause audit related to a clinical systems vendor that caused a dispensing error in a phase 2 study. And it was all due to a bug fix that was implemented, seemed innocuous enough, but guess what? It broke some code related to dispensing that was previously working. And so what we had there was a failure to do sufficient testing, including regression testing. It delayed a submission, resulted in a for-cause audit, and a significant financial impact. It almost cost some people their lives, believe it or not, due to being prescribed active ingredient when they were supposed to receive placebo. Right. Ask a knowledgeable third-party vendor to review what you've collected, whether it's clinical, regulatory, IT, doesn't matter. Maybe it's a combination of two. Done that. I've co-audited with other subject matter experts to review what you've collected. And the key here is you're looking for gaps, right? Again, it's about pattern recognition. I've learned over the years, you don't just detect a trend in what you see, you also can see trends in what's missing. That is often the case. Something that should be there that isn't is a really big item here. And lastly, you want to prepare talking points. More importantly, creating no talking points. In other words, don't talk about this particular topic if you're preparing to receive a for-cause audit. You want to have those talking based upon what you learned by your own investigation. You want to have your talking points for key staff members who are likely to be interviewed, as well as senior management. The idea is prepare the team on what to expect how to answer questions. And if you've been in an audit before, you know, short, factual answers. Don't let anyone want long-winded explanations. That's where you get tripped up. And by the way, no offense to my IT friends out there, but technical people tend to want to explain in detail. And all that does is result in more things to dig into. So keep the answer short, factual, and move on. Okay. How to respond in the event that you have been notified of a for-cause audit. Well, number one, you want to control the narrative. You want to make sure that as few people as possible are communicating with the auditor or the client or sponsor, whatever the case may be. Make that someone who's experienced in hosting audits. You want to minimize the number of people the auditor can access whenever possible. Control, don't let them wander the halls or wander the shop floor or things like that, where they can randomly stop and talk to people. You want to escort the auditor at all times. As I mentioned, technical SMEs at IT are prime targets because they feel that they have to explain everything. They want to, they feel they're protecting the company, protecting you by explaining everything, and that's the worst thing you can do. And you want to establish a response team. Who's going to be responsible for what? Remember, minimal number of people speaking to the auditor. Definitely preserve records. That may sound like Captain Obvious, but you'd be surprised. You want to preserve everything, and that's why I said you collect the evidence, store it in one place, a secure place that only you can access, and arrange it chronologically. Talk about centralized communications, a little redundant there. Another thing, a big one, avoid speculation. Stick to only what you can prove, or at least what you have evidence on to formulate a hypothesis. And don't overcommit. If you don't know the answer, say, I don't know, I'll look into it. If you don't have the record, don't know, I will investigate it. I'll see if I can find it. And really important, you want to brief senior management on how they conduct themselves in an audit. If they're not a quality professional or experienced with audits, they also tend to want to talk too much to over-explain things. So what I thought I'd do here is explain exactly how I conduct a for-cause audit. The first rule that I'm going to tell you is, and this is a hard one, assume nothing. Why? Because the best way to go down the wrong path and waste precious time is to assume you know what the cause is likely to be. And of all the times I've had to do that, it almost always was not where I was expecting it to be. And I'll give you a super short example. Early in my career, before I was involved in life sciences, I was an IT troubleshooter. I resolved critical problems that even the big guys, Microsoft, Cisco, IBM, couldn't catch. Why? Because they had a biased and myopic view of what they thought the problem was, or they were trying to defend their territory by showing what it couldn't possibly be. Either way, that takes you down a rabbit hole or rabbit holes and really gets you off track. So it's the old, when all you have is a hammer, everything looks like a nail syndrome. So assume nothing, go in with no expectations. Remember, a for-cause audit is like any investigation, and for me, I take a reverse engineering approach. Let me demonstrate that. The first thing I do is create a timeline, and then I work backwards on the timeline, collecting all the evidence that I pick up at each of the events or points in time. I then I'm going to analyze all that evidence. And one thing I want to mention, I already covered communications, source documents is a big one, audit trails, and system testing. I want to let you know that testing evidence, and that's what you need, testing evidence is the #1 cause of all system-related issues, is lack or insufficient system testing. It happens a lot. I then, once I have all the evidence in place, arranged chronologically, I start to form a hypothesis or hypotheses that starts to take me down the path. Then I interview all the parties involved, and I take copious notes during those interviews. I associate them with the evidence that I've accumulated. And then, if it comes up, there we go, I go back and I cross-reference those interviews, comparing what one person said to what another person said. And now the picture really starts to become clear. Let's talk about leadership for a moment. This is an often overlooked area. If leadership didn't see the signal, either the reporting structure was broken or there was precious little oversight. So remember, from a regulatory perspective, senior management is responsible for establishing and maintaining an effective quality management system. They expect, FDA expects oversights as governed by 21 CFR 820 and ICH E6R2 Section 5. Remember, culture drives compliance. It starts at the top. Silence or delay or tolerance of weak controls signal to me an acceptance of risk. And then failure indicators in for-cause audits often include CAPAs that are open beyond 180 days and no executive review, repeat deviations, resource gaps that are known but not corrected, perhaps due to budget, and inadequate trending of complaints or investigations. That's why we do management review meetings. All right, let's talk about recovery. So the root cause audit has been conducted or is going to be conducted and is in progress. If you've done your own preparation, you're preparing to recover, right? So you do your own root cause analysis, but does it point to another party? Perhaps it's a vendor, a partner, sometimes even the sponsor themselves. Could be a bad protocol. I've seen that happen. So maybe you had protocol errors that were due to a poorly written protocol. Happens a lot. Third-party systems, I mentioned that before. So especially in the clinical world, could be a contract, a poorly written contract. But if it's none of these, then unfortunately you own it. So, and if you own it, you need to anticipate the damage, which could result in lost revenue, fines, and market reputation. So once you've gotten through the audit, the goal here is to really prevent this from happening again and be able to prove that you have, because you're going to have to send a response to that audit, which legal is going to be involved in. So you need to have real CAPAs. You need to remediate whatever the problem was, whether it's manual or electronic systems. Maybe you need to redesign the process. Management needs to demonstrate that they're going to be heavily involved going forward. And you need to rebuild confidence both to regulatory agencies as well as your clients. So maybe you have something in mind now that may be in the works, maybe not, but now's the time to get ahead of it. You want to assess your current risks. You're going to look for some of those triggers that I mentioned. They may not be readily apparent. Validate the important things, what matters. You don't validate everything, but the important topics. There we go. And you want to prepare before the auditors do. You have an advantage. If you think it's coming, do your own root cause analysis and get to the bottom of it and start preparing for the response ahead of time. So just to go over what we learned today, that for-cause audits are signals And they shouldn't be surprises. They usually aren't. The scope always expands. So if it's just one protocol deviation or a couple of or problematic investigator site, there's going to be more digging. Your systems and your vendors matter. Make sure you look at them. And what's the old saying? An ounce of prevention is worth a pound of cure. Preparation is cheaper than remediation. And silence and delay only increase your risk. So before I wrap, and I will take questions, before I wrap, just to give you a sneak peek, we're doing another webinar next month, which is going to be how to bridge the gap between spreadsheets and commercial software using Smartsheet. We do a lot of that. It is Part 11 compliant. We build and validate GXP solutions on Smartsheet. And that's it. I welcome questions. I'll hang out here.